Now, the Competition Commission is set to investigate the private healthcare industry. Government wishes to cut healthcare costs for millions of South Africans who can't afford to attain private care. As we delve further into this, we're joined by Trudy Makaya, Deputy Commissioner at the Competition Commission. Hi Trudy, nice to have you in the studio again. We seem to having you quite often because there are lots of things you have to investigate. Looking at that healthcare issue, perhaps just take back a step and what prompts you to investigate a sector, and what has prompted you in this case to go for healthcare?
Okay, so we're working within our new powers to conduct market inquiries, and I think these powers have added a new level of sophistication to how we do competition policy in this country, because it's not just about pure investigation of behavior of specific companies. Here we're saying, here's an industry that seems to have certain problems. We see expenditure increasing above inflation, we're seeing tariffs increasing, and we want to understand what is driving that. Why is the consumer feeling this pinch? So it's about trying to understand the competition dynamics and the market dynamics in private healthcare to then come up with proposed solutions.
All right. Let me ask you to pause there and ask Ian, as an outsider, in the sense that he doesn't have to do this sort of work. On the face of it, would you say the healthcare industry needs such an investigation?
Very much so. You know, I think we just have to clear the air. It's fine for those of us who have a medical aid scheme, and increasingly it's becoming more expensive.
Well, even if we do have a medical aid scheme,
it's becoming more expensive anyway. But for those that don't, it's incredibly difficult. I just had the experience of trying to help my gardener to get some medical attention, and I was taken aback. At a public hospital, he had no money, which I gave him some. They wouldn't see him if he didn't. There's something wrong with that system. And then I compare it to what we have to pay the insured part of the population. There's a huge difference. Somewhere they need some imbalancing. So all the more power to your looking into it.
Well, there you have support. And of course, a lot of people wouldn't care about the construction industry, but they do care about healthcare because it affects everyone. So how do you proceed here?
So the way we proceed, we've published a draft terms of reference that sets out the scope of the key questions that what we want to look into, and we're inviting people to comment on those draft terms of reference. And then, as per legislation, the final terms of reference would then be placed in the Government Gazette. But at this stage, we want as much consultation and public input into the process, because there's so many different stakeholders with different voices, different insights, information, and we want to enrich the inquiry with all those perspectives.
Of course, it's quite complex, and I always think of it as a sort of tripartite, often conflicting arrangement, because you've got the hospitals, and you've got the medical aids, and you've got the pharmaceutical companies, each with their own issues. So, I mean, will you be looking at each of those segments to see if there's competition? Because in a sense, obviously the hospitals aren't competing with the medical aids.
Yes, so this is the interesting thing. So it's about looking at competition within each of the segments. We're trying to prioritize which segments we look into. So we want to look at the core of providers and payers and see, is there competition within those segments? How is that working? But also, more importantly, the relationships between them, because a lot of it has to do with bargaining and agency. So your medical aid represents you essentially in bargaining for services, and providers, then also have their own investment interests to present to the table when it comes to coming up with tariffs. So we need to understand, is that process working efficiently? Are there imbalances that might be driving it one way or another? And what are potential remedies to the distortions that we do uncover?
And potential fines, potential penalties.
So the thing about market inquiries is that they're aimed at more when you really want to understand a market and try to get to the core of the issues. Of course, if we uncover anti-competitive conduct, we would then initiate an investigation. But you see, it's not primarily driven towards, prosecution. It's more about, we want to understand what are likely to be policy recommendations coming out of this process.
Because the one area which it's like the advocates in law, the doctors. And would it be a surprise to find that each of those three sectors, the healthcare, the hospitals, the medical aids, and the pharmaceuticals, well, pharmaceuticals separate, they are also price controlled in some respects, they are capped, but the doctors can charge what they like. You can't actually investigate the doctors, or can you?
Well, if we did see that there were problems or literally any contraventions in the way that there were certain prices or there was certain collusive outcomes, we would investigate that. But I think here primarily it's about the system and how it functions, not so much about people acting in anti-competitive ways. But if we do find that evidence, we would obviously pursue it.
Ian, is the market interested in this in terms of those listed companies? There's several listed companies in this sector.
I think so. And you know, just the news right now, Cipla Medpro, their shareholders have agreed to the company being taken out by an Indian company. And I was just hoping for an opportunity to ask you, doesn't this take away from competitive situations? It's going to be less competitive. There's going to be a close tie-up, a vertical integration, which will make it that more difficult for other people in the industry.
I think we would have to assess a transaction on a case-by-case basis.
Yes.
Vertical integration usually comes with some efficiencies, but those have to be balanced against any exclusionary ways that non-vertically integrated firms would then suffer. So I think one would need to balance those two out and see in a specific transaction what the
Quick word, Trudy, before you go, on the construction sector, which you, I think, are wiping your hands of now. But 18 companies, I think, under investigation and some collusion. A couple of them, Robex and Stefanuti Stocks, 358 million, 58 million. Some big numbers to come here still.
It's a bit too early to be talking about numbers. I know some companies are making provisions and therefore they're trying to give the market indications. But we are in the final stages, so as you can discern from that, we have engaged with companies to say, this is what we found, this is the likely penalty that you're going to have. But we're hoping that in the next month or so, when we approach the tribunal, that's really when we can talk numbers.
Well.